Hey guys, Sarah here. College with COVID hasn't been as difficult as it may seem. You wear your masks when you're inside buildings and in class, and when you're outside in the fresh air, you don't need to. It's my second year being at college with COVID. Thankfully this year, all my classes are in person. I don't have any online classes because of COVID, and I'm so thankful for that. I honestly think Cayman is ready to reopen. I think it's been long enough and people are ready. You just have to be smart, remember to wear your masks and social distance. COVID's not going away, so we need to learn to live with it.
Hello everyone. We've done a lot of PCR tests as usual over the weekend, and these amount to some 3,500 over the weekend and a further 1,250 done in the 24 hours from yesterday until today. There are also a number of community positives over the 3-day period from Friday, Saturday and Sunday. This totals 669, which obviously is a large number. I think it's important to realize, though, that we now have over 200 reports of lateral flow tests embedded within that 669 figure. And the total number of positives who have been reported through lateral flow testing is now 832 people. When we give the total number of cases for the islands since last year, that includes our lateral flow positive tests. And the total number of cases since last year is now 3,354. So those 669 positive cases are from community, and there are a further 9 people who tested positive when they were exiting quarantine. They've obviously remained in isolation. Our active cases are now 2,118, which gives us a prevalence, which means the number of people suffering or having contracted SARS-CoV-2 being around 3% across the islands. We are doing an awful lot of testing, not only in PCR testing, but also in the lateral flow. And the whole purpose of this testing is to try to identify people who are positive, because people who are positive for SARS-CoV-2 can go on to spread the infection. So I very much appreciate the community's commitment to this program. By isolating when you're known to have SARS-CoV-2, we will bring down the positive rates in the community by keeping the infections out of the community. Needless to say, as we introduce the policy, we're going to pick up an awful lot of positives at the start, and so I very much appreciate continued cooperation with this and following the policy. Just to remind people, if you look at gov.ky/coronavirus, there's an awful lot of information about how the lateral flow policy should be used. There's infographics and other information to help you, whether you be yourself or an organization trying to implement the policy. As far as hospital admissions are concerned, we currently have 14 people in the Georgetown Hospital of the HSA currently, 5 of whom are needing extra oxygen, but there is no one on a ventilator and no one needing enhanced respiratory support. To give you a little bit more detail about that, I think it's important to understand that not only are people being admitted, but they're also being discharged. So since Friday, there have been 14 people in total admitted, but at the same time, there have been 12 people that have been discharged. And that's what you would expect. As people get treated, they get better, and they're able to go home again. For vaccinations, our current total vaccinations are 118,285, of which 57,105 are first doses, representing 80% of our population of 71,106 people. 54,857 people, or 77% of people, have had the 2-dose course, and 6,323 have had a third or a booster dose. Because we are now giving this booster dose not only to people who are over 40 as of this week, but also to frontline workers of any age, it's difficult for me to give this breakdown by age on a daily basis. So all I can say at the minute is that 6,323 represents 9% of our total population of 71,106. Thank you.
I'm ready to reopen Cayman because it's time that our friends, family, and tourists are able to come once again and visit our beautiful island.
When we open up the borders, travel is going to be freer and we're going to be able to travel between countries better.
I'm ready to reopen, to be reunited with my loved ones living abroad.
I'm ready to reopen.
Well, thank you all for joining the CMR COVID Spotlight. I'm your host, Kevin Watler. Sorry about some of the technical glitches that we had earlier, but we look like we got them all worked out. Topic tonight is going to be diabetes and COVID-19. And we do have Dr. Kumar joining us for this evening. And welcome, Dr. Kumar, to the CMR COVID Spotlight.
Hi, Kevin.
So, Dr. Kumar, please share with our audience. Just tell us about yourself and give us a little bit of your resume, so people kind of understand what you do for a living, where you work, and why you are a COVID expert, especially in the topic of diabetes.
See, friends, I am Dr. Kumar. I work at Total Health Grand Pavilion, Cayman Islands, and I am basically an internist trained in diabetology. And I have got a special interest in diabetology for last 17 years. I am working in this field. Since I have undergone training in diabetology, and I have seen almost more than 10,000 patients of COVID, especially on daycare, category 1, category 2, and category 3 patients. So I'm more dedicated towards diabetology management, especially in case of this COVID era. So I basically interested in this field, and myself did my post-graduation in 2 fields. One is internal medicine, diabetology, and second in critical care, both of them from University of Delhi in 2003 and 2006 respectively. Thereafter, I took my training in clinical diabetology, and thereafter I started my career as an internist with diabetology. Later on, I got trained in different parts of the world, and finally I'm landed here in Cayman Island. Since last 9 months, I'm working here as a clinical diabetologist and internist.
So you mentioned something that I don't think everyone's familiar with. What's category 1, 2, and 3? What exactly does that mean?
See, this categorization for COVID patient is basically made so that our management is clear among them. We categorize as category 1 COVID patients who are basically asymptomatic, the patients who are COVID positive, but they don't know they are positive. Neither they show any kind of signs of symptoms, okay? Basically carriers. And thereafter, it comes to category 2 who has got mild symptoms. These categories can be, they can be sharing between the 1 or 2 category. But again, more or less, while the management, we consider these categories. Category 3 are basically those patients who are hospitalized, needs hospitalization, mostly the oxygen therapy. And the category 4 are the critically ill patients. So their management is totally different from category 1 to 4. In 1, basically, the moment we come to know that patient is asymptomatic and he or she is a COVID positive, in that case, we ask them to get isolated. No hi-fi medication, nothing is required, only supportive can be given. Still, if patient is under high risk, suppose he has got some comorbidities or he is of age more than 65 and he is on immunosuppressive, then the categorization is 1 up. For example, if he's from category 1 and he has got high risk factors, he will automatically be considered as category 2. As the categories becomes higher up, they need more and more vigilance. I mean, they need to have more and more monitoring regarding their respective disease and they themselves. So categorization is an important thing while doing management of the patient.
Well, thank you very much for that, Dr. Kumar. And just want to also just make sure you all know who are watching, that you also, if you have a question directly for Dr. Kumar, you'll see at the bottom of your screen a little call in link that you could utilize. If you come on in, you could go ahead and ask your question live. If not, you could also type your question in the chat. And again, we do ask that you share with your friends and family that we are currently live, and anyone that you know has diabetes. We know lots of people in the Cayman Islands, they have diabetes. And so this topic is very, very important, especially as it
Yeah.
relates to COVID. We want this information to definitely get out to as many people as possible, because ultimately this is information that, we should know. Information is a very powerful tool, and we want to make sure that people are well informed as we navigate the COVID pandemic that we are in. So we've got a first question for you, Dr. Kumar. COVID-19 infection, how common is it among those who are diabetic?
See, first of all, COVID-19 infection as such, the incidence of COVID-19 among diabetic patient and non-diabetic patients, people, is same. They has nothing to do directly with diabetes, but it has been seen that the people who are diabetic, especially the uncontrolled sugar levels, uncontrolled diabetes, in them, the complication rate is high. Otherwise, if you ask me about the incidence, it is equal in both the diabetic and non-diabetic. Again, the reason behind why diabetic population, especially the uncontrolled diabetes patient, develop more complication is because of their chronic inflammatory state. This can be understood in a way that a person who is a diabetic already under chronic inflammatory state, and suddenly he gets a acute inflammatory add-on effect of COVID. Suppose it could be anything, any viral infection, but since we are talking about COVID infection, so COVID infection itself is an acute on effect plus chronic inflammatory state that leads to derangement of sugar level, and it could even lead to failure of sugar control in previously controlled sugar people. So diabetes itself, regarding the common thing, is equal incidence, but it increases the incidence of complications among diabetics. So this is an important thing. Again, if patient has got comorbidities, like he's a diabetes, along with he has got some other comorbidities, like he is a hypertensive patient, he has a chronic renal disease, chronic heart disease, etc. In those cases, the complication rate will be more, and it will be more worse. So we had to be, more vigilant in diabetics, especially those who are basically on insulin therapy. I mean to say they have got high risk of uncontrolled sugar levels or with comorbidities.
So that kind of, touches a little bit on my next question regarding type 1, type 2 diabetes. What's the difference when it comes to COVID? Is someone that has type 1 diabetes more at risk than someone that has type 2 diabetes?
So before that, I will just, in short, I will explain you the difference between type 1 and type 2 diabetes. Type 1 diabetes is a form of diabetes which is less common. First of all, the incidence, suppose I've got 100 patients, out of that roughly 10% is type 1 and roughly 90% are type 2. Type 1 diabetes are the people in which the insulin production is less or deranged. Okay. In type 2, more or less the insulin production remains normal, but there is a resistance of its effect. That means the insulin level could be high also, but because of insulin resistance, the sugar level are not controlled. So in COVID patients who have got type 1 and type 2 diabetes, overall the complication rate is more in type 1 because they are highly prone for this kind of increased incidence of complications with respect to type 1. But the recovery from COVID infection has been seen opposite. It has been seen, interestingly, better in type 1 with respect to type 2. Why? Because the age of onset is less in type 1 diabetes. So overall, we can say that complication rate is more in type 1 diabetes, but recovery rate is also better in type 1 diabetes because they are younger with respect to the type 2 diabetes people.
Thank you, Dr. Kumar. What about complications faced by a diabetes patient with COVID infection? Can you kind of say what some of those complications might be?
See, again, complications, the type of complication remain the same. The common complications in type 1 is basically, we call it a medical term called diabetic ketoacidosis, which is an acute medical condition in which sugar level get out of the range in the blood. That's why there are some alternate pathways in the body which convert that sugar into a ketones. And that ketone is again toxic, cytotoxic. So that increased level can lead to excessive urination. There could be a loss of sugar leading to, dizziness and all, increased blood sugar. and obviously secondarily leading to change in overall shape. I mean to say change of significant weight loss. These things can happen, and because of this ketone, acidosis may be caused. Then this acidosis can lead to shutdown of heart and kidney, the vital organs in the body. So the most common complication which always remain in diabetes type 1 is diabetic ketoacidosis, which is further increased because of COVID infection or any other viral infection. If you go on type 2 diabetes, type 2 is basically the complications which we see here, basically infections. For example, any skin infection, any urinary tract infection, any kind of infection. So in COVID infection, they secondly get prone for bacterial infections involving the urinary tract, kidney, other vital organs, skin, genitalia, etc. And if they have got some underlying infection previously, they will be aggravated in case of COVID infections.
Now, is it possible for COVID-19 to cause someone to become diabetic by any chance?
See, again, Kevin, this is a very interesting question, and I will give you also a very interesting answer. If you ask me, is it possible to develop diabetes in a previously normal patient post-COVID? Yes, this is possible. Okay, I will let you know why I said so. But technically, this is not so common. Okay. So what happens if you go with the life cycle of this virus? When you are infected with this virus, it gets inside your respiratory tract via your nose or mouth. From there, it binds itself with the mucosa of the respiratory tract. From there, because of different mechanisms, it crosses that barrier, get inside the blood. From there, it may reach up to different organs, including pancreas. And pancreas is the organ which has got beta cells, which are supposed to be responsible for insulin production. If you see that theoretically this virus goes up to pancreas and they infect the beta cells and they destroy those beta cells, definitely it will lead to insulin deficiency and lead to diabetes type 1 especially. There are few reports, but this is not commonly seen. So answer to your question is, can it lead to diabetes? In previously normal patient, yes, it can lead to, but the chances are very rare.
Thank you for that. Now we're just going to switch over to the comments. I want to make sure your questions are being answered. So again, if you have any questions, either call in. The link to be able to join the show is at the bottom of the screen, as well as you can just write it in the chat and we'll be able to pick it up whether you're watching on Facebook or YouTube. But we do have Rachel asking, are there any pre-existing conditions that mean vaccination against COVID is not recommended?
See, in the era of this COVID infection, as we are looking at pros and cons, I mean, there are different agencies throughout the world who are giving guidelines for COVID vaccination. All of them say one common thing, that is, if the patient is at high risk. For example, when we consider thrombogenesis, for example, if a patient is supposed thrombogenic, he has got some disease which may lead to clot formation. In that case, we have to be extra cautious. But again, before that, he or she has to be she has to contact with his personal doctor, who will decide whether patient is get benefited or it can lead to worse complication in them. In that case, this vaccine has to be decided by his doctor, that whether he should undergo vaccination or not. Preferably, right now, all the agencies say it's better to get vaccinated, if possible under vigilance, so that the chances of infection itself, which itself is a thrombogenic thing, the chances becomes less of thrombogenesis. So recommendations are go with the vaccination under vigilance if he or she has got some pre-existing condition. So it's better to get the vaccination.
So COVID, some people might argue that COVID is not that different than the flu. And before you answer that question, you came from India, where COVID was really a horrible situation right before you came to the Cayman Islands. Kind of share your experience and kind of what was going on there, and how similar is COVID to the seasonal flu?
See, there is a big difference between the two. Okay, clinically, in the beginning, both normal seasonal flu and COVID infection are more or less same. In the beginning, I said, okay, because the virus of normal flu generally reside in the upper respiratory tract. If you look over your throat, there is an Adam's apple, which anybody can appreciate. If this airway, it generally infects. Okay, but in COVID infection, most of the time it infects first this upper airway, thereafter it goes inside the lower airway. Okay, the COVID virus itself is more aggressive. I'm talking about COVID-19, not the normal coronavirus. I'm talking about coronavirus 19 strain, which is just discovered in 2019. It is highly aggressive. It's highly infective. It crosses the barrier, that is the mucosal barrier, very easily, and it spreads in the blood very fast. So again, answering to your question, that what is the basic difference? Basic difference is its aggravation. Okay, if you ask me about the time period of infection, that is called incubation period. This varies from different to different condition. Roughly, it is from day 2 to day 6, and most of the cases, when we get on the stages, most of the cases get complicated by stage 2, that is between day 6 to day 12. After day 12, they say that this virus is either controlled by the body or it has already spread it. So that have got different results. So in India, what happened? If I basically, there were different waves. So second wave was very, very aggressive, because before that, the population was not so much, exposed to this COVID infection, and it's a highly populous country. So again, to manage them, to let them understand, and also to follow all the norms of distancing and hand cleaning and everything is very difficult in populous country like India and China, because people there, they live more people in less space. So especially the market is and all, they are full of people. So it happened in from Feb 2020, Feb 2021 to May 2021. And this leads to a lot of damage to both social, psychological, economical, all the fronts, you can say. We have tried a lot to save them, but because of this wave, we were also not, trained about this before that. And also the disease was new for mankind. Overall, the disease was new. So we don't know about the results, and we are not prepared for such kind of epidemic emergencies. So it was a very big loss for a country like India. But again, we learned out of our mistakes, and now we are more trained there also. And that experience let me have such a confidence in me here, even that I can manage such kind of thing even in future.
And we know COVID cases in the Cayman Islands is really starting to pick up. I mean, whether, the unvaccinated, which we know right around 80% of those who end up hospitalized are unvaccinated. It's not the vaccinated people that are getting into the hospitals, but yet we do know there's a good amount of people who are fully vaccinated that still are getting COVID, which we know, again, the vaccine is really keeping you out of the hospital and getting seriously sick. But at the same time, it helps you not get it. But if you do get it, I mean, it's possible. But what are some of the concerning signs and symptoms? Say someone is at home and they're doing well, but then things start to get a little bad. When is it someone needs to start worrying about, okay, I need to go to the hospital?
See, first of all, everybody should understand what are the early sign symptoms of COVID. Because in COVID, we say that as early as we pick up these infections, we can control it faster and with better results. So in the beginning, it has got ditto same symptoms like that of normal flu. That is sore throat. It may start with sore throat, fever, running nose, myalgias means body ache and muscle pain, etc. But for me, the two most common category of people which are of more concern are, first of all, as you said, are non-vaccinated people. Okay. And second is people who are at the high risk. That means high risk population. For example, people who are more than 65 years of age, who has uncontrolled diabetes, uncontrolled hypertension, uncontrolled cardiac illnesses. He or she is already on immunosuppressive therapy, or he has got any multi-system disease or vital organ disease. These two populations are at the high risk. So the guideline says that anybody who has got symptoms which you could think that is matching with the COVID-19, he or she must be tested for PCR COVID, okay, by PCR technique. And if he is positive, then again, he has to inform to his doctor and isolate himself. He will categorize the thing, manage the things. And if he is negative, then he can continue his normal activity. But in both of the scenarios, he has to follow the norms of social distancing, hand cleaning, that is with either 70% alcohol or frequent hand washing, and try to maintain his hydration well, because this step is very important in all of the infection, including viral infection, diabetes, anything, okay, except he's a case of heart failure. That is a different thing, but I'm talking about a normal person. Hydration, good nutrition, good sleep, social distancing, and hand washing. These are the 5 basic steps for better prevention of COVID infections.
But let's say again, they're home and they're starting to feel a little unwell. When is it they should say, okay, I need to call 911 or I need to go to the hospital? Is there any common signs and symptoms you'll experience at home where, okay, it's time to go?
First of all, again, if he or she has got developed the symptoms matching with COVID infection, he should undergo PCR for the COVID infections. Okay, for that he need not to visit hospital. There are different centers in Cayman Island, 3 centers in fact, including the HSS center is in Camana Bay, one in West Bay. This different centers. But if he has got symptoms like excessive dizziness, uncontrolled fever like 102, 103, and not responding to oral tablets, his underlying disease is uncontrolled. For example, he's a diabetes patient, suddenly his sugar increased to 300. Okay, dehydration, any associated medical illness which has made him feel bad, very very bad. I mean to say he's feeling very uncontrolled, out of the condition. In that case, better to go with visit hospital, get admitted, and from there he can undergo investigation on OPD basis only done when the patient is hemodynamically stable with no signs symptoms suggestive of any kind of hypoxia or respiratory distress. If something happened out of this thing, respiratory distress, hemodynamic instability, he has to visit the hospital first. From there, we send the sample for PCR.
And in terms of treating COVID, we know that there's monoclonal antibody treatment. I believe you at your office at Total Health, they do have some on stock or in stock. How do you determine whether someone gets monoclonal antibody treatment? Because I do know that you're supposed to get treated with it before you get really, really ill. It's not for those who are seriously ill. It's more if you are to prevent that serious illness. How do you guys determine at your clinic that someone should be treated with monoclonal antibody therapy or one of the new COVID type of treatments that is likely going to be available in the not so distant future in the Cayman Islands?
Yes. Kevin, regarding monoclonal antibodies, first of all, I will clear it what this monoclonal antibodies means. Monoclonal means single directed against a single antigen. There are antibodies, and how they are made. They are made basically, suppose I am been infected with COVID infection today. When I recovered well out of this, they collected my B cells who used to generate these immunoglobulins. Out of that, they squeeze the immunoglobulins out, and then they multiplied it over a period of time, and then they packed it in a container that prepares a respective monoclonal antibodies, and this process is universal for different diseases. Now, if you talk about COVID infection, none of the immunoglobulins right now are 100% approved by FDA. But they are used for emergency purpose use because there are a number of trials is yet to be confirmed. I mean, they have to be proven or passed. But there are monoclonal antibodies. If you ask me about different immunoglobulins, suppose bamlanivimab, this is difficult to pronounce and understand also, along with the atezolizumab or storvimab. These are few of the examples. And most common trade name which is we are using in Western world is Regenco. These monoclonal antibodies can be given to those patients who are first of all PCR positive, that means confirmed cases, who haven't get complicated yet. That means suppose if I start this monoclonal antibodies within the first 10 days of diagnosis or starting of the symptoms without any severe complication, this will give me an excellent results. So this monoclonal antibody should not be given to a category 1, which I have explained in the beginning. Category 1, the stable people at home who are asymptomatic, they should not receive it. Or very complicated, critically ill patient, in them the results are very difficult to say whether they will give the results, because in their body the infection has already been spreaded, and these injections are quite expensive. So we don't know the result of this thing. But these injections of monoclonal antibodies are very effective in especially category 2 and category 3, who are stable patients and they're highly prone that they may undergo severe illness category. So for them, we have reserved these drugs, and they are basically injectable ones. Now we have got injectable emergency approval from different agencies, especially from FDA, for emergency purpose use, and we are using it for confirmed cases who can come to OPD as a daycare. And this injection is for suppose 1 or 2 hours, depending on the patient's condition. They can receive it, they can stay here for maybe 1 or 2 hours for observation, and they can get back home. Very easy for infusions. And regarding the side effects, there is no major side effects we have found yet, but definitely anaphylaxis is one of the documented side effects. To counter that, that's why these all injections are given in the doctor's presence, or in the daycare unit, or in the special medical units. They are not given at home or any non-availability of medical staff people. So they have got very nice results, especially in category 2 and 3.
Yeah, and I will tell you, I'm not sure if you're aware, but I'm actually in Florida. I work for the health department currently, and when Delta variant started to really overwhelm the hospital systems, and hospitals were absolutely jam-packed and overflowing, and really they just had no space. What the governor ended up doing as one of those things in the toolkit was he released a lot of monoclonal antibody treatment sites throughout the state, where it wasn't given in a clinical hospital setting, but they had, just like you had public vaccine sites, to really get people, especially since it was kind of funny because people said, I'm not going to get vaccinated because they call it experimental, yet they have this product that is not fully FDA approved, and they'll go ahead and take that. But the thing is, regardless, they got it, and it really does a very good job at preventing serious illness.
If you go with the figures, till now, roughly 100,000 people has already got this monoclonal antibodies in US with very excellent results. And the beauty of this injection, though it's not finalized still, is that they have decreased the mortality significantly. Not only mortality, hospitalization also. So as I said, it can be given in daycare center like Total Health or any other daycare center. We can give it. But definitely, since there is always a risk of anaphylaxis, so we give it under presence of any medical staff. We cannot give it at any place. So we follow the same trend as guidelines has been given by the FDA or any higher authority.
And that's really good to know, because if someone is COVID positive in Cayman and they want this as an option, whether they're vaccinated or not vaccinated, but they might have some of those risk factors, especially, and they want to get it, at least they do have it. I know you said at Total Health. I don't know about the others. No one else has said that they had it. I do know the Cayman Islands Hospital is also starting to get some as well too. But at least if someone wants it, they can go to Total Health. But what are some of the requirements? I know you said category 2 or 3 probably, but do you have to have comorbidities, or is it based, the patient knows about it and request it? Walk me through your process if they wanted to go again to Total Health and get treated with monoclonal antibodies.
Given there are indications for giving this monoclonal antibody, you cannot give it to anybody. Okay, first indication is he or she should be in a mild to moderate category, as I said, category 2 or 3 so-called. This is mostly given in people who are non-vaccinated, okay, or those people who are vaccinated with high risk or high risk population, or old age people in which we think that their body is not responding to the vaccines and they are not able to produce the antibodies. It's logical that if the patient has got adequate level of immunoglobulin, then why should I give monoclonal from outside, but when both are antibodies? So it's clear cut that it has to be given to those people who are either vaccinated with we expect that his body is not responding well and his immunoglobulin levels are less, or unvaccinated people or high risk population. Plus, they must lie in category 2, 3, mild to moderate category. They cannot be from category 1 and category 4. So these guidelines are clear, and these 4 are the only indications. Other than this, the results are excellent. So we can give this thing to these kind of populations, and we can avoid their further complication. And I have used it personally. They have shown excellent results.
Thank you, Dr. Kumar. And so Sophia Bush is asking, how long does the virus last in a positive asymptomatic individual?
See, this is a variable answer, but I can give you a small figure of 12 days. Roughly, it's 12 to 14 days is the life of the virus. If you cross, suppose I am infected today and I have got no symptoms for up to, that's why 14 days is given. Okay, 12 to 14 days I pass it. That means after that, there is no chance that this same virus can further get complicated inside me, or I can spread this thing to further. So it's 12 to 14 days is the upper limit.
Okay, and we have another question over from Sari Dixon, and the question is: if you're exposed to one variant, can you contact the same one again? They were told no in the past, but they're not quite sure of that answer.
See, if you are exposed to one variant, simple thing, that virus that indirectly will produce an antibody in your body for that specific strain. So there is no chance that at least for 3 to 6 months, because after 3 to 6 months this antibody get decrease, you are going to be infected with the same strain. There is a possibility that you may get infected by some other strain or some other virus, but not of the same virus, because this is like a natural immunization. So natural immunization will at least make you settle for that respective strain for 3 to 6 months. You are not going to be infected, but you have to follow the same isolation criteria, that mask wearing, cleaning hand, etc. You don't think that you are now infected, so you are totally immune and you don't need vaccines. Sorry. Why? Because this natural vaccination, I mean to say the infections itself, we have got no control over this, and we cannot judge exactly how patient got immunity development, immune response is there, and immunity development after that natural infection. But this can easily be assessed in case of vaccinations. So vaccination, even if you are infected today and it's 3 months past or 4 months past, you have to take vaccine still, the guideline says.
Next question was: what should people with diabetes ask their providers, their doctors, about boosters? Should they be getting vaccinated if they have getting a booster if they have diabetes?
Sure. Answer is yes. Regarding vaccination, there is no guideline difference between a diabetic versus non-diabetic patient. You have to follow the same. In fact, your booster can be taken earlier, because it has been seen that the uncontrolled diabetes, especially of the older age group, their response to respective vaccine is less. So the chances of immune boosting in them post-vaccination is less. So boosters are mandatory in all people, including the diabetics, but in these classes, that is uncontrolled diabetes with old age, the booster can be taken as early as 4 months of the last dose.
And we got Alice saying good night to Sandra, as well as myself and Dr. Kumar. She's saying good night to us. And we're going into the next question. What side effects of the vaccine should people with diabetes pay attention to? I know probably touched on it a little bit, but I'll go ahead, because people are joining sometimes at different periods to watch us.
Good. No, it's a nice question. So regarding diabetes, vaccination has got more or less same side effects, which is common. Like if you go with the local side effects like soreness over the site, swelling, pain, myalgia, headache, in some cases blurring of vision, and these side effects, the incidence of side effects is same between diabetes versus non-diabetes. There are nothing to be differentiate between that diabetes has got more side effect and non-diabetes less side effect. Answer is no. Both have got same side effects and same incidence.
And another question is: can someone, can some diabetes medication amplify the immune response to COVID-19?
No, sorry. There is no such medication which can amplify the immune response to COVID-19. Rather, it can be other way around. As I said, the uncontrolled diabetes people may show less response to vaccines, so they may need booster earlier with respect to a normal person.
And from Julia, she's asking, and she commented both. So can both vaccines be taken at the same time?
I mean, you mean to say both two, 1 and 2 at the same time?
Yeah, I think that's what she's asking.
No, not possible. If you're thinking that you will take the double dose and it will lead to more immune, no. Answer is no, because these volume of vaccine is fixed after trial basis. You have to take in the similar fashion one, thereafter 3 to 6 weeks break, and thereafter the second one.
Got it. And onto that question, she did just comment and said, yes, that's what she meant. But, and I know the answer to this because I was one of them, but can you get the flu vaccine and the COVID vaccine at the same
Yes.
time? And I know that's
Yes.
yes, because I got
Very interesting question you have asked, Kevin. I am
yeah.
very, I'm very obliged to answer this thing because this is a very big confusion among people. So, two antiviral vaccines like flu and COVID vaccine, they can either be taken at the same time at two different sites, one here, or something, okay, buttock, etc., at the same time or at 1 month apart. The guideline says it can be taken at the same time. But again, if patient is, old age and all, high risk patient, there's a high chance that he may develop side effects. For example, though they are mild side effects, but they may develop the side effects like migraine and all. But again, it's very easily manageable with paracetamol or Tylenol tablet, and he has to take some rest. But this recommendation is acceptable that both can be taken at the same time at two different sites.
And that's exactly what happened to me when I got my booster shot. I got my COVID booster inside my left arm, and in my right arm they gave me my flu jab. And I was asking the nurse at the time, can you do it in the same arm? She says, well, if you did it in the same arm, you're going to absolutely hate me.
Yes. Yeah.
So let's go on to another question from a viewer. Should we be tested before we take the booster shot?
No, there is no such guidelines to be checked before the booster shot. Why? Because see, the level of antibodies, FDA is a top body. FDA say there is no indication to check the level of antibodies in COVID infection people, or it gives a guidelines to take the booster sooner or later. This is because if you go in molecular details, there is a B cell. There are B cell and plasma cells who used to produce these antibodies. So this is not about the level of antibody in the blood, but this is about the B and T cells in the blood and respective plasma cells who are going to decide how much antibody you are going to produce when you are going to expose to this COVID infection for the second time. So as she has asked, should we be tested before taking this booster shot? Answer is a big no. If you are planned to take the booster, take it. There is no need to check the antibody level before the booster shot.
And do I need to worry about DKA? I'm not even sure what that is, but maybe that's something you might know.
DKA, I've just in the beginning started, is a diabetic ketoacidosis, which is a complication of diabetes, more commonly seen in type 1 diabetes. And again, this is a strong complication of type 1 diabetes, especially. So regarding the, do you need to worry about DKA for vaccine? No, never. You have to continue vaccine, etc. Even if you have suffered with DKA in the past, so you have to take the vaccine, first of all. Second, this is right that if you're presently suffering from DKA, but again, that is a medical thing, medical emergency. You're not going to stay at home. DKA patient cannot remain at home. He or she has to land up in hospital for that. In that case, being a doctor, we don't give vaccine. We control the DKA first. Then after we give some time of 2 to 3 weeks, let the sugar level as much as possible control. But meanwhile, we have to save that patient from any kind of trans infection. So he should not get infected from somebody else. So vaccine cannot be given at the time of active DKA, but definitely after its control, we have to give it.
Thank you for that. And we got caught up with the questions in the comments. But again, if you have any questions, this show is for you all. I want you to get your questions answered. So if you have any questions for Dr. Kumar, go ahead and write it in the chat. We'll definitely ask your questions. I got a list here to go with some more, but we did just get one that popped in from Rachel, who is asking, should people who have tested positive for COVID get vaccinated as soon as they are allowed to leave their isolation?
No. Now the concern is if you are COVID infected, that means you are naturally vaccinated. You get infected with a virus, your body responded to that, produces an antibody. So you have already got antibodies in the blood. So there is you may take, but again, we should wait for that. And the waiting time is from 2 weeks to 12 weeks. Why? Because your body has already antibodies against this COVID infection. Even if you take the vaccine, there is no harm in that. But 2 weeks is minimum, and up to 3, because after 3 months, this natural antibodies will start falling down. In that case, you need to start this vaccination process.
And we have Frank asking the question, can the COVID vaccine cause one's diabetes to change your blood sugar level to where it goes out of control?
COVID infection vaccine itself don't lead to any kind of change in sugar. Rather, it saves you from infection of COVID. So it has got no vaccine. COVID vaccine has got no direct impact over your blood sugar levels. But if you are suffering from COVID, you are taking any other steroids or something like that, because of that, sugar level may change. But answer to your question is, COVID vaccine cause one's diabetes to change? Answer is no, never. Because vaccine is not a medication. It's basically a type of either mRNA or killed virus or something like this, depending on the type of vaccine. So it is not going to influence the sugar level directly.
And we have a question from Alice saying, Dr. Kumar, if my A1C is 5.8 from 18, should I take the booster?
Yes, answer is a big yes, ma'am. You should, you must, because now you are almost in a non-diabetic range. If you go with the books, it's 5.7 to 6.5 is a pre-diabetic range. You are in a almost controlled manner. So now you can take your booster. And if there is a gap of 3 to 6 months from your second dose of vaccine, definitely you should take the booster now.
And we have someone really appreciating this conversation. Thank you so much for coming onto this platform to speak about this again. Really appreciate the folks at Total Health for making you available, because again, these are very important topics. I know so many people who are diabetic, whether it's type 1, type 2, doesn't matter. We know people, everyone knows someone who is diabetic. And we do know we're living in a world with COVID among us, and we really need to know these little things. We did a show that talked about the heart in COVID-19. We're talking with diabetes and COVID-19. We're also going to have a show coming up next week with nutrition and COVID-19, how your diet is very, very important to, one, keeping yourself healthy while you have COVID-19. So we want to make sure we bring these very important topics to you all. If anyone has any ideas, please send it to me. You could email me at kevin@kmanmallroad.com, but you could also send it to Sandra, or just write it in a chat. Reach out to me on Facebook, and you can see my handle is at PIO Kevin W. You can just reach out to me, and we will definitely, try to get your questions answered. So we got more things coming on in. Again, we have another person saying, great, thank you. They really appreciate it. And now Frank is asking, if your blood sugar level is averaging 300, do you take the booster?
See, again, if you have got severely uncontrolled sugar level, as this lady, this fellow has got 300, I think he should control his sugar first, and straightforward, he should go on insulin therapy, because it's an indication for insulin therapy. Okay. And he or she can give a gap of 2 weeks after controlling the sugar level, so that his body respond well. Right now he can take booster, but that may become a failure, because body won't respond well to this booster shot. I want to utilize this booster maximum. That's why I'm asking you to control your sugar first, then wait for 1 or 2 weeks. Then you should go with the booster. Till then, avoid follow all the social distancing and hand cleaning. Just avoid of the COVID infection.
And then we did touch on this one, but for the sake for someone that might not have heard it, I heard there is a pill for COVID. Is that true?
See, again, this is a very nice question. I really appreciate this listener, Mrs. Sanders, because this is a very interesting thing. Recently, British Health Agency, BHA, has approved, though this tablet which I'm talking about is called Molnupiravir, Molnupivir. This is a medication or tablet approved by British Health Agency, and they claim in their third phase trial that this tablet has reduced hospitalization and mortality by almost 50% when started in second or third category of people. And the dosing is very simple, twice a day for 5 days, but yet to be approved by FDA for full-fledged use. But definitely this salt is there, and people are, now it has just published, last week only. So, now this demand will happen, and the manufacturer of this brand or this salt right now is Marks. So, there is her question to her answer is yes, and the salt name I just told you, and the dosing is there. Soon we will, start writing this as this is become available in the market.
Right, and I do know the FDA here in the United States, that's the regulatory authority for approving these type of medications. They do have it scheduled to review the data, which by all indications it looks like it's positive. That it's going to be approved by the end of the month. I want to say it's the 30th of this month. Either way, if that's not the exact date, by the end of this month, they'll have that meeting to determine whether it will be approved for
Yes.
emergency use authorization in the United States. We know in England it is already approved. So that's something that will likely be coming down in the very near future. But do you know if Total Health is looking at purchasing that to have that as well?
So we are basically running behind all these new technological advances and newer medications. We are up to date with all kind of new treatments for COVID and diabetes management, because we want to be ahead with respect to whole of the other fields, other people. So we are trying to get it hard. If probably we'll get it sooner. And as we get, because when the border will open, we expect, this is not a positive expectation, but a negative expectation, that COVID infection may increase. But hope that people are vaccinated here. As Dr. Lee has told, that 79% are either one-time vaccinated, so chances of infection is very less. But in that case also, they may need oral therapy is better option, because it's cheaper, easily available, can be easily given with less side effects. So definitely we are trying hard to get as soon as possible at Total Health.
Absolutely, that being as proactive as possible is so necessary when we're dealing with it. And Cayman Islands, unlike the rest of the world, really had the advantage of watching and seeing and waiting for some of these things to come along before that was even an option elsewhere. So it's awesome that we're in the position we're in to be able to protect everyone. But Rachel's now asking, should children who are diabetic or pre-diabetic get vaccinated as soon as possible?
Answer to her question is, since this vaccine has been approved till age of 12 only, so for 12 years of age, yes, the answer is yes. But below that, these vaccines, the trials haven't been yet proven or approved. So for them, you have to follow the government guidelines. But above the age of 12, answer is yes. We have to be vaccinated.
Yep, and we do know that approval from 5 and older is coming pretty soon. And here in the United
Yes,
States, I know we just had a shipment in Florida that we just pushed out, and they're now getting it. In fact, one of my friends just sent me a picture of her son, who is, I think, 6 years old or so, either 6 or 7, getting vaccinated with his big smile. And so it's amazing that we do have something to protect some of the younger children coming on soon. I know the Cayman Islands will be looking forward to that once it's available, but it's just not there yet, at least for
actually, I am also waiting for the same, because both of the kids are below 12. So I am also waiting for the same.
So you're one of those parents. Come on, let's go.
Yes.
We got Denny Warren Jr., and I think he's asking a question based on something you said earlier, but he said, is Dr. Kumar saying that no bone marrow plasma cells are created in response to SARS-CoV-2 infection?
No. I didn't say it. I mean to say that these plasma cells, basically, when they are formed via the natural infection, their life, it depends. It's variable. We cannot, directly judge how much time these plasma cells and these antibody will remain in the blood, because we haven't done any kind of trial on infected people. This is not ethical to infect you first with any infection and then see the level of plasma cells and all. So ethical committee give only approval to the drugs. So we have done these kind of trials only with vaccines, not with the natural infection. This is not possible. Okay. So as Mr. Dennis said, that saying that no bone marrow plasma cells are created in response to, no, sir. There is formed, but I said that we cannot regulate it because it's a natural infection. We can regulate only the levels when we vaccinate the people.
And so got a question. We got caught up, I guess, with the comments. But again, if you have any questions before we close off the show, please send your questions in now so we could go ahead and get your questions answered by Dr. Kumar. So we do have another question here saying, what should I do if someone in my household tests positive for COVID-19?
Can you repeat, Kevin?
What should I do if someone in my household tests positive for COVID-19? So you have someone that's positive in the home, but someone that's not positive. How do they cohabitate?
First of all, it depends how big is your house. Okay, if your house is big enough that you people can isolate in two different rooms, isolate with the immediate effect. Okay, I mean isolate the patient in that, and you reside in the second room. If you cannot isolate in that case, then you can reside in the same room. It's your compulsion. But in that case, according to the latest guidelines by the Cayman government, that the second guy who has got no symptoms or only he or she is a contact, he has to undergo lateral flow test daily. Okay, if vaccinated. And if it is negative, then only he and she can come out of the home. If he or she is not vaccinated, then he also has to be isolated at least for 10 to 14 days. This all depends on the vaccination time.
So we have some people that might want to ask the question about, can disinfectants be ingested as a preventative measure for COVID? We know some people are thinking about ivermectin as well as other type of drugs as well. So while we're talking about disinfectants, let's talk about that as well too. Is that a good way to treat anyone that's COVID?
No, actually, what happened maybe 1.5 years ago when this infection was new in the community, and even in India, we have tried everything because there was no such treatment for coronavirus. Because before COVID-19, it was normal flu virus, just like a coronavirus. But the strain which appeared in 2019, which was named as COVID-19, because as I told, it's highly infectious, so there was no measures to control. So we tried everything, like we tried ivermectin, we tried azithromycin, doxycycline, different kind of medications. But over a period of last 1.5 years, we have come to more specified solutions and more specified answers to COVID infection. Simultaneously, our research has shown that there is no gross benefit of mortality or hospitalization on using ivermectin or azithromycin. So now the recommendation is there is no benefit of using such kind of medication. Either classify category 1, give no treatment, give only symptomatic if you want to give it, or switch over to these medications which I just talked to you, the immunoglobulins, the newer antivirus which we have tried. Ritonavir is also effective, but there are variants. There are two schools of thought. One say it's effective, one school of thought say not effective. Remdesivir is again used. So these newer medication is used now, but definitely ivermectin, azithromycin, doxycycline, which we have used 1.5 years ago, now they say there is no benefit of using that because they are not going to decrease the hospitalization rate or mortality rate.
And Dr. Kumar, I want everyone who is watching to really understand kind of, again, where you came from. You came from India, and you were there when India was experiencing the worst COVID infections since COVID began. And you were in the war zone of COVID.
Yeah.
You remind us how many patients you've seen, as well as what the situation was like when you were there treating COVID people.
So sometime I recall those days and get scared. This is my answer. People was like, I won't say that, see, system is good because I was in the center of the India, that is New Delhi. The facilities was good, but those facilities were not made for such kind of situation. The same thing happened in US. The system literally collapsed there, okay, because of the load, not because the facilities are less. So again, at that time, the problem was people were not vaccinated. Vaccine were not developed till then. Till the second wave, the vaccination though started, but it haven't covered even 5% of the Indian population. Now they have, vaccinated more than 1 billion people out of 1.3 billion. So now the rate, then only we come to know that how important this vaccination is. That's why I request all people, whoever can take it without any complication or without any, their doctors, if they say not to take, that is a different issue, but they must take. Vaccination is right now the most important weapon against COVID-19 infection. So there in 2021, our first 3 months of this thing, the oxygen demand was on the peak. There was no beds available. People were obviously not able to, tackle this situation. In fact, the healthcare workers got infected. So if suppose I get infected, I can manage suppose 100 patients in a day. Think those 100 patients are going to be accumulated. So this kind of situation was very bad at that time. But now the things are different. Almost 2/3 population, more than 2/3 is vaccinated. And here the best part in Cayman is almost 80% is vaccinated, at least one vaccine. So Cayman is probably, I hope, I also pray with the God that Cayman don't face that situation which happened in India and the US.
And again, I just want you to reiterate again, you were there when India was, at its worst, when it came to, with the levels of infection and people not necessarily having some of the treatments available. And again, ivermectin was tried. And I do know some people in Cayman saying, well, if I get it, I'm going to try ivermectin and other things. Again, I would like you to just state from your experience, being in India, being on the front lines and seeing how that was used, what was the results?
So Kevin, actually I have used at the personal level I'm talking about 3 molecules. First ivermectin, second doxycycline, and third is azithromycin. This was used in big amount in first, and also the HCQ, hydrochloroquine. These 4 salts were very, very commonly used in first 3 or 4 months of the COVID. But my personal experience is not of much benefit. Why? Because those people in which I have started, more or less they were of either category 1 or 2 and they get benefited. But more than that, I'm in category 3 and 4, they ultimately landed up in a hospital. So there were no gross benefit out of these tablets, but this is my personal observation. But now we have got articles in which they say that there is no gross difference between use these medication or don't use, it hardly matters. Even you start in the first go, the results are of not much significant difference.
Thank you for that. We got Danny Warren Jr. also saying, so doctors cannot then say that natural immunity doesn't last. I think that was in response to one of your previous comments. Do you want to provide any feedback on that?
Sir, again, any kind of immunity, either natural or vaccine, they have got its life. Why? Because that's why we talk about boosters. If I'm so confident about any infection or vaccine, then why I'm asking for boosters? So guidelines are always there. Now, if you go on the molecular level, the memory cells are there, different types of memory cells, which are inside the body, which shows response are formed with respect to first infection or first vaccination. They have got their life. So suppose mostly they are around, say, 6 to 9 months in most of the cases. It could be more also, it could be less also, depending on the disease. So if you don't give booster, then the level of antibodies will sooner get down and those memory cells start disappearing out of the circulation or from the bone marrow. So that suppose your memory is getting lost. So you fail to identify the same infection in future. That is why boosters are required. So as Mr. Rennie asked, so can it last for long? No. Every immunity thing has its life depending on the nature of the disease and nature of the response.
Right. And I know when we've brought on some others on the show, other experts who's dealt with COVID, what we've been told is if you got COVID in the past and you didn't really have severe illness, if you just had mild symptoms, it looks like you are likely able to get it again much sooner than if you had it really bad. If you had COVID and you might have been hospitalized or you suffered a lot of the side effects or symptoms that COVID would bring, your immunity seems to last a little longer. That's some of the, you would say anecdotal, some of the initial data that they're seeing, yet to be, completely confirmed, but that's what they have observed. I personally do know individuals who got COVID 3 times in the United States. They got it very, very early days, kind of right before Delta came, and then they got Delta. And again, each time they had kind of a milder form until they had Delta, and a couple of them had it a lot worse at that point in time. But yes, absolutely. It's something that can happen again, and the best protection you could really get is to add vaccination to it.
Yes.
So we do
again these kind of vaccinations or natural infections. Let it be clear about this: these vaccinations are not treatment; they are prevention. This has to be dead clear. Okay. So even if you are vaccinated, that doesn't mean that you are not going to be infected. Sorry, sir. Answer is no. You are going to be infected, but the complication and its spread in your blood or in your body will be less. That's why, as Dr. Lee said, that none of the patients at the moment in ICU are fully vaccinated. It's clear. And this is not about Cayman. This is true about throughout the world. People who are fully vaccinated, they hardly land in ICU and they hardly get complicated. So these measures has been made to avoid complication. I cannot seal your mouth with these vaccines. So if your mouth is open, you are coming in contact with any person of COVID confirmed cases, that means you are going to be infected, but it will reside till your upper airway. It is not going to cross that thing and not going to create a lot of complication in the blood. So that's why throughout the world they say, even with vaccination, everybody say, including WHO, wear your mask, follow the social distancing. That means avoidance of infection can be done with the social distancing only and the masking only, but complication can be avoided because of vaccination or natural vaccination, as you said.
And absolutely, and some of those who might be fully vaccinated and end up in the ICU, they typically have a lot of other things going on. It's not because they just got COVID, but they likely have some they're immunosuppressed. They have other issues where they might be they have COPD or they have leukemia or something that is going to, contribute to going downhill pretty quickly, where the vaccine might not have offered as much protection because your body immune system is already not in a very great area.
Yeah. Okay. As Mr. Adams asked, but again, there is no lateral flow test available, and when they are expensive. So answer to first question is, we are trying hard to get it in a larger numbers, okay? Because England government has approved only 3 companies of lateral flow test. You cannot do lateral flow test of any company, okay? First of all, so we have to bought only those 3 companies, which has been approved by the British Health Agency, first of all. And second, to answer to his second question, expensive, sir, sorry, I cannot answer about this thing, but definitely I think this should be managed by the people who are in administration. Okay, this is not my domain, so I'm sorry to answer the second question.
Yes, and I know the premier was on the morning show with Sandra, and she, the premier said to Sandra that he does not like the prices that some people are charging, and they're watching it very carefully and will intervene. The government will intervene with pricing if it is too astronomical. So we'll just have to kind of wait and see. But yes, there is a shortage of lateral flow tests available on the island from what many people are experiencing. So hopefully, in the very near future, they'll be able to get more in, because it's certainly a tool that is needed in order to get things really back to moving in the Cayman Islands. So we do have Katie with another question saying some people have a harder time getting vaccinated. Some people have a harder time after getting vaccinated. Does a rough response to a vaccination mean you will have a stronger resistance to COVID versus hardly a response to a vaccination?
No, Katie, this is not like this. But again, you are right that if body shows some response, you are confident that your body is producing antibodies. This is right, okay? But if you think that if you have got more side effects of vaccine and you are generating harder response with respect to the vaccine and producing more antibodies, answer is a big no. This is not possible. Because in most of the cases, if you ask me about the figure, 90 to 95% of people are either symptom-free post-vaccination or very mild symptoms like mild flu, mild soreness over the site, etc. But that doesn't mean that those 95% people have less immunity with respect to those 5% of the people who has got a harder response of the injection or vaccination.
And we have Denny. He's asking now, is there something within the vaccine that provides better protection than natural immunity?
So again, there is no such comparative study of natural immunity versus vaccination which we do. This is because both has got the type of say response to disease is same, but again they have got different ways. So in natural thing we cannot study. As I said, we cannot ask you to get infected and we follow up with you. But we can do the study in normal vaccination. So as sir has asked, is there any something within the vaccine that provides better? Answer is no. There is nothing or something. But what is happening? The chances of complication of there is a term called collateral damage. If you are infected with something, COVID-19, and then you generate antibodies, that while doing that, you may get complicated and you may get serious, critically ill. This can be avoided while vaccination, because in vaccines, we try to make those antigen in such a way that you don't receive any kind of complication. Though still we get some complication out of that. but there is no adjuvant in that which can increase or decrease the level of vaccine. It depends on type of infection.
All right, Dr. Kumar. Well, we're going to go ahead and get into closing comments. I don't see any more questions in the box, but as you know, if anyone has any last minute questions, now is the time to ask Dr. Kumar. Again, he's a diabetes expert with a lot of COVID experience, coming from India, where COVID was really out of control while he was there, putting his life on the front line to protect people. So he's definitely one of those who could speak from experience. He's now in the Cayman Islands working for Total Health, and he is here to share his knowledge and wisdom with everyone in the Cayman Islands as he serves the Cayman Islands population now. So if you have any final questions for him as he gets into the COVID, the final remarks, please type it in the chat. But Dr. Kumar, what would you have to say to the people of the Cayman Islands before we say goodnight?
See, I've got two requests to all the people of the world, including Cayman Island. First, get vaccinated if you can. If there is some reason, some solid reason behind that I cannot get vaccinated, that is a different issue. But if you can, please get vaccinated. This is the only thing which can save you from COVID. Second thing, even after vaccination, follow the social distancing, cleaning your hand with 70% alcohol. Those guidelines has to be followed. And this is the only thing which is my request to all of you, so that my job is also less and you people are feel better.
And
so there's one more question.
Yes.
Can diabetes be reversed? Sir, answer to this question is an interesting question. I can take you a separate session on this question. But again, diabetes is labeled when your body is in that category in which you are not able to control the sugar out of the range, and that range is fixed. Suppose if you talk about fasting level, it's more than 126, and PP level 140 or 200, depending on the type of time of the postprandial levels. So we say that pre-diabetes can be 100% reversed, but diabetes 100% reversal is not possible. This is a possibility that it can be controlled very nicely, maybe with diet and exercise. Medication may not be needed, but again, the moment you lose those things like diet and exercise, even if you're not taking medication, definitely it will come back.
Well, Dr. Kumar, I really appreciate you taking the time tonight. Of course, we started off with a few little technical glitches. I am so glad that we were able to get them worked out, and we got all of the questions that came in answered. Again, thank you so much for taking the time again to the CMI COVID Spotlight. And so in the morning, Sandra will be on first thing again to go ahead and do her thing that she does. She does it very well. We know everyone does love the different topics that she brings. This morning show was excellent. Again, if you missed it, Premier Panton was on the show where he provided a lot of different information. We talked about his trip to the climate conference, as well as some of the things going on with the government and how they're addressing some of the developments of COVID. So really appreciate everyone for joining us tonight, where the topic was diabetes and COVID-19. Hope everyone has a wonderful night. If you are one of those in the Cayman Islands who have COVID, please, we wish you a speedy recovery, wish you the very best. We want people to get well very soon. And again, if you're not yet vaccinated, we really ask that you take the opportunity to get vaccinated. We do know that those who are in the hospital, they're doing well if they're doing very well if they're fully vaccinated. But again, the ones that are in the hospital are usually those who are unvaccinated. So we want to make sure that we are protecting one another. The vaccines are certainly something that works. So thank you for all of the comments. And, we got a lot of people messaging now saying that they appreciated the show. Well, we also appreciate you for tuning in and watching the CMI COVID Spotlights. We're trying to do our very best to provide that education for everyone, so they have ultimately, that information to make informed decisions. So hope you all have a wonderful night. Stay safe, everyone in the Cayman Islands. I love you all very much. And we'll see you next time. I'll see you on Thursday when I do the next CMR COVID Spotlight show. Good night.